you be happy to give us an introduction, please?
Yes, of course. Morning, everyone. I'm Caroline Shaw. I am the head of complex needs at a large adult social care provider organisation in Scotland. And we have embedded PBS Teams. So we have 11 behaviour support advisors who provide support across our services within our organisation.
Thanks, Caroline. And which area are you going to speak around today, Caroline? It might just be useful for us to let everybody know today.
So today I'm just going to maybe share some of my reflections around our embedded PBS team within a social care organisation, how we've been trying to embed a PBS model throughout the organisation. So looking at that kind of whole system approach to implementing PBS.
Fabulous. Thanks, Caroline. Jo, we can come to you next, please.
Hi, everyone. So I'm Jo Coulson, and it is lovely to see so many familiar names and faces for the people that have got cameras on. Hello. I am the director of Supporting Positively. So we're a PBS consultancy business that works with a whole variety of different providers and people who are trained to be PBS practitioners and UKBA certs. So my area of interest that I'm talking on today is around enhancing staff wellbeing and how that's important for the system and maintenance.
Thank you, Jo. Brilliant. And yeah, I can see on the chat, and you can guarantee this, someone's typing away. Great. I love it that you're multitasking. You're way better than I am. I could not be doing that. But if you could put the mute on, it'd be much appreciated, because I can tell it's bothering some people. Thanks very much, guys, whoever it is. Good on yous. All right, let me just check. That's fabulous. Background noise and rattling. Yeah, hopefully we're on it. We've got it. Hopefully we're on it. Cool. Thanks, folks. David, could we come to you next, please?
Good morning, everybody, and fantastic to see everyone. I am the founder of iSupport Behaviour, which is a very similar service, if you like, to PBS UK and to Supporting Positively. I've been working in autism and learning disabilities since I was 19, and I'll be 53 this year. And I have extensive lived experience in terms of people in my family, immediate family, that are autistic or have a learning disability. And my area today will be thinking about PBS readiness. How do we know that an organisation, a family, are ready to work in a PBS framework and to implement that? And I think there'll be a lot of overlap between the different conversations, and that's likely to happen with this, but I think it will set kind of like the scene.
Lovely. Thank you, David. That's great. And yeah, thank you, whoever figured out who the tapping's coming from. Thanks for sorting that out. That's really helpful. Much appreciated. Was it you, Leanne? Named and shamed. Look at you. No worries, mate. Thanks, pal. Charlotte, could we come to you next, please?
Yeah, good morning, everyone. My name's Charlotte Harrison, and I am the PBS lead for Swanton Care. So I've been working with sort of systems-based PBS within Swanton. We're still quite early on in our implementation of PBS, so I'm right in the thick of kind of some of the barriers and challenges that comes with trying to implement system-wide PBS. But I've also got some previous experience with other organisations in sort of implementing PBS at a systems level for a social care company. So my topic today that I'm going to be talking about is that kind of need for organisational buy-in. So not just assuming that if you get the buy-in from the kind of senior leadership team, that then everyone's going to be very accepting and willing of your vision and support with that. So just talking through some of the things that I found really helpful within my career to gain that buy-in at the kind of different levels that might be required.
Lovely. Thanks, Charlotte. And we've got lots of questions about that kind of buy-in stuff that came through the survey as well. So I'm sure we'll get to a lot of that as we come through today. So Great. All right. Well, look, I think without much further ado, I think let's get started because I think there's going to be lots of discussion. So if I remember, I think, David, did we say we were going to start off with yourself first, wasn't it? Yeah. So the floor is yours, my friend. Over to you. Would you like me to put your slide on?
Yes, please. Yes, that'd be amazing.
That. And thank you. And oh, hang on a sec. What are we doing? Here we go. First keyword is Snape. Put it in there because I know I'd forget otherwise. All right. So anyway, right, here we go. And David.
There we go. Thank you. So good morning, everyone. I'm going to talk about PBS readiness. I'll give an overview of some of the work that we've done in system-wide PBS. And I think one of the reasons why I'm going to go first is that actually this theme sets the scene for everyone else. We've got our visual here. We've only got 5 minutes, so I shall be brief. Why is readiness really important? Well, kind of understanding what PBS is and understanding whether a family, a team, an organisation, a social care setting, an inpatient setting, or any service where PBS is going to be implemented, understanding that you're ready for this is really the foundations of being successful with PBS and particularly that systems-wide approach. I'll give you a brief overview of a piece of work that we did. It was one of our earliest pieces of work in this area, and we worked with a reasonably large provider. This was pre-pandemic, and it was a service provider that was working with children and adults, and it was a campus setting. It was quite a beautiful setting. We were asked to come and support this organisation to help them to develop a system-wide approach to PBS. We were relatively new to doing this. We put together a fantastic plan. We put together fantastic training. We had great relations with the service and the leadership and the management. But ultimately, it wasn't the success that we were hoping for. And the reason for that is that the service just wasn't ready. It just been taken over. There was new leadership. There were issues within the staff team, within the management team, and there were issues around leadership being undermined by management and management being undermined by direct care staff. So we had this issue where consistency and predictability was never going to happen because the leadership wasn't there. There was a lack of understanding around what actually PBS was and what this was going to do for the service. And there wasn't communication amongst kind of the wider organisation about what was going to happen, what were the expectations, and what people were going to be taking part in terms of training, supervision, and guidance towards that implementation. So what we see here is really that readiness, that leadership and that culture is essential to being ready. It has to be an agreed definition and a shared understanding of what actually PBS is. There are frameworks and there are agreed frameworks, but there has to be good contextual fit within the organisation. And if the frameworks are not a good contextual fit, we come back to our service. The walls are the leadership and the management. The leadership must drive that PBS, and the management must be ready to embed that. And without those foundations of that readiness, the leadership will not understand their roles and responsibilities in terms of the implementation of PBS, and the managers won't understand their role in terms of embedding PBS. The windows of our service are the transparency, the openness, the evaluation, if you like, almost overlapping with values. And I know that Paddy's going to be talking about that shortly. A key piece that will be discussed today will be around buy-in, but that buy-in will come from staff, management, and also leadership. So co-production and bringing everybody in on a journey and having engagement with everyone at every level of the service is central to this. If we can bring people along the journey rather than telling them what's going to happen, things are more likely to be successful. We have our doors. This is access, inclusion, co-production, and we have our being ready means understanding that this is going to require quite a change. If you're a family and you're working with, you're supporting your child, whether that's a young person or an adult, or whether you're a service inpatient setting, you have to understand what PBS is and that implementing this requires sustainability and a longer term vision. It's not just about that plan. It's not just about asking staff to carry out what's written within the PBS plan. It's about the long-term vision for the organisation and what happens beyond the first month of the implementation and the second month and the end of the first year and the second year and the third year. It's about embedding PBS into strategy and understanding that, again, PBS isn't just something that we add on, it's the foundations of our service. There has to be continual monitoring and evaluation. Being ready for PBS means we understand that this is a data-driven process and decisions are made in a data-driven way. And the success of the implementation of a system-wide approach means that there has to be appropriate systems and processes to monitor and evaluate the success of the implementation. PBS, and this is something that we see, and I'm sure Paddy and Joe sees regularly as a consultancy service, that there's an over-reliance on utilising one person or a small group of people that are the PBS lead or the PBS champion, and it's their job and their role to implement PBS, where actually a really key part of understanding that you are ready for PBS, that you are ready to implement a system-wide approach, is that it's not just the leadership and the management, it's also the systems and processes that needed to be embedded into HR, into your recruitment processes, into your training, in your workforce development, supervision, the structures around management. It also needs to be embedded across operations. So PBS isn't just one person's responsibility or one part of the organization's responsibility. It cascades down from the leadership and it cascades down into key supporting services within the organization, down towards the management and then into the direct care staff. So this will be my final part. PBS is, and system-wide PBS is implemented effectively with the consideration of, are we ready for PBS? Quality of life can be significantly changed at the endpoint where the individual is being supported. And that's really the goal here, isn't it? It's thinking about the people that, whether it's somebody within a family, someone in an inpatient setting, someone in a school or a service, what barriers are there to their quality of life? And understanding that culture, leadership, and being ready for PBS are as important as the functional behaviour assessment. I'm going to finish there. Thank you, everyone.
Lovely. Thanks, David. And I think it really dovetails in Amy's presentation that was in this stream just earlier today. I think it really dovetails in that readiness around preparing your staff team for what's about to come, and that's not a one and done exercise. There often needs to be kind of multiple opportunities to engage people to make sure that stuff's actually embedded and taken on board, right? Really great, David. Thank you very much for getting us started. To anyone in the kind of audience, please do, if you do have questions, feel free, kind of put them in, because if it works, we can ask the kind of questions at the end of each person's kind of section if you want, before we open up. It might be tricky for everyone to remember what's going on. So please do, if you've got stuff that you want to ask any of the panelists, just stick it into the chat. I'll just have a quick look now. Got someone else? No, we've got thanks, David. Well done. Great. All right, brilliant. Caroline, I think we're probably ready to move on to yourself, if that's okay.
Lovely. Thank you, Paddy, and thanks for having me along today. I'm really pleased to be able to share some of my reflections from a kind of social care provider's point of view as a provider who've been developing an in-house PBS team over the last 20 years. So we've been doing this a long time. And hopefully what I'll share with you is maybe just picking up from some of the context that David talked about, is maybe some of the practical ways that we've been trying to embed PBS. I guess one of the early lessons that I think we learned was about making sure that we embedded PBS into our organisation's strategic plan. So I spent a lot of time, and still do spend a lot of time, engaging with our senior management team. So I try and schedule regular meetings with our CEO and our directors to really understand what their views and expectations are regarding PBS, to try and get a real perspective on what they understand about the model and how it's applied in practice. So I think my reflections would be not to skip over or underestimate how important it is to spend time working on a clear vision with senior leaders from the onset, and also to keep returning to that vision when there's drift in practice. And I think that kind of alludes to what David was saying about understanding the organisation's contextual fit. And certainly, I suppose, in the field of PBS, we're seeing more and more the emergence of implementation science models to really help us think about ways to plan for culture change and how to help organisations adopt new models and practices such as PBS. And I guess one of the key lessons that we learned was around how we changed the mindset from PBS being a crisis intervention model. And with that, I mean that our team would receive referrals when there were difficult times happening, or when behaviours of concern had really escalated to a point that staff were feeling burnt out. So again, it was about trying to get buy-in and show that there's better, more efficient ways to implement PBS. So we really had to demonstrate and show evidence from practice that if all we did was crisis support, then all that happens is that we keep getting referrals coming through. And I guess one of the ways I think that can be really helpful is by looking at ways of sharing good practice across your organisation to really show what early intervention PBS can achieve. So to show that PBS is about establishing good, robust support systems that reduce that need for crisis support. And one of the ways I'm trying to do that is I hold bi-monthly online CPD sessions for our senior management team. So for us, that's our kind of area managers who oversee our services. And we meet and we talk about things like ways that we could upskill our workforce in PBS. So we tend to focus discussions around that kind of tier 1 supports. And we look at how can we help our frontline staff understand that PBS can help improve quality of life, and why not to call on us just when things are going wrong, but how we can really help ensure support matches a person's needs and preferences through developing things like capable environment. I guess I've taken a similar approach when working with our commissioners of complex needs services. So a few times a year, I invite commissioners to join us for an online discussion forum. And I set that up so that we could talk directly with our commissioners about PBS and share examples from practice. And we discuss things like funding. So as we all will have experienced, when things are going well, we find that funding is cut. So we want to discuss with our commissioners examples of how when this happens, we see behaviours of concern returning. And for me, I think what I found most useful when engaging with commissioners is really finding a commissioner who gets what we're trying to achieve through PBS. So when we have these discussion forums, it's a commissioner leading this discussion and helping me talk to other commissioners about PBS. And I think that's been really important and sings to that co-production and partnership working that David spoke about. And I guess overall, what's been most beneficial is spending time trying to ensure that PBS doesn't just sit alongside our organisation. And by that, I mean really volunteering our PBS team to be involved in decision making for the organisation. So to help make sure we're not forgotten about, that we have a voice in our recruitment process, that we have a voice in our induction process for staff, and how supervisions are done, and how service quality is monitored. And I suppose lastly, I'm conscious of the time, Paddy, I know I'm talk on. So I suppose lastly, for me, I think what's been the biggest help has been spending time with other social care providers and joining PBS community practices, joining cross-sector networks. So really asking other sectors and roles to help educate me on how to embed PBS in social care, and seeing the time spent on those discussions as a real priority and is real part of the solution to how we embed PBS, is getting that co-production and seeing things from other people's point of views. So I hope that was helpful from a kind of social care perspective and our reflections on kind of how we've been approaching the of embedding PBS across our organisation. So it's not just kind of part of it, but it's woven through everything we do. I'll pass back to you, Paddy. Thank you.
Lovely. Thanks, Caroline. Brilliant. I'm just having a look at some of the questions that are coming in. We might bring some of these back to the end, I think. Yeah. Oh, this was probably relevant actually, just on the back of yours, Caroline, if that's all right. So someone's asked, how did you demonstrate and show that crisis support was not the way forward?
Yeah, I think for us, what PBS is really good at is that we're data driven. So we have the tools to show when what's making the difference for behaviours of concern reducing, what's making the difference to improve people's quality of life. So it's using the tools at our disposal. So for us, it was about really putting some data together to show, look at the amount of time we're getting re-referrals, and look at what happens when we have maybe a couple of core members of staff. So we might have like the frontline manager leave and the skill leaves with them. So isn't there a better way to use a resource? Because we know these are some of the barriers that are happening. So how else could we embed PBS? And really framing it as, here's the evidence of why Tier 1 works better. Here's the evidence that if we focus our attention on not crisis management, we'll reduce the crisis. We won't need it in the first place. So I think it's using what PBS is good at and gathering your data and being able to present that. And it can be helpful. I don't know if that's useful for folk.
Absolutely, I think so, Karen. That's great.
Can
Yeah.
I jump in there, Paddy?
Please do, David.
It's a really good question, and particularly around the use of restrictive interventions. PBS has a really solid base in terms of supporting organisations, supporting with this agenda around stamp, the restraint reduction network. We have fantastic steer, but in practical terms, the evidence base for PBS is that it reduces those restrictive practices and it reduces the crisis model. Yeah, thank you.
Yeah, really good. Thanks, David, and thanks, Caroline. And I think, one of the, I'm going to kind of weave in my stuff as we go along, I think, rather than me do something at the end. But I think, one of the things I was going to discuss was around kind of values. And I don't know if people are familiar with the pro-social movement. If people aren't, I would really strongly recommend having a look at the pro-social book, because there's some fascinating approaches in terms of developing strategy, developing new approaches that use the ACT matrix. So it's a fantastic tool. There's a lot of questions about how do you get buy-in, how do you get people to participate in this? And the real, for me, it's quite a simple answer, often more challenging to deliver, but it's about engagement. We have to engage our direct contact staff. We have to engage families. We have to engage senior personnel within organisations, and having those values-based questions and using that ACT matrix to look at what's showing up and what's getting in the way of us actually delivering the things that we're passionate about is really key. So I think looking at the ACT matrix, but some of the stuff that we're talking about here as well, I think, Caroline, and the stuff that you and David are talking about, it saves money, right, as well. Now, look, I know that most of us in this field, that's not our kind of primary consideration, but we all work within businesses. And businesses are there to make money, whether we like it or not, a lot of the time. So actually, I found a lot of opportunity working within organizations, and we need to really understand the pressures that senior managers are under sometimes. What are their key performance indicators? And we can get upset about that, but very often there's going to be a financial key performance indicator. Some of this stuff saves significant amounts of money, not only in terms of kind of the crisis response, but in terms of turnover of staff teams, in terms of recruitment, etc., etc. So sometimes it's really important that we're able to figure out how can we connect what we're doing with the goals, the values, the objectives of the business, as well as the stuff that drives all of us, that we just want people to have a better quality of life, a better experience, but figuring out how to harness that stuff and use it in your narrative within your organization. What are the really important things within your organization? Not just what people say, but what really is, what drives behavior within your organization. Because if you can connect your programming and your strategy to the things that are driving that business forward, you might get that momentum. It's a really key way of getting that buy-in from senior personnel. Can you help your senior personnel in your organization achieve their objectives, whatever they may be, is a really significant one. But yeah, just that general engagement more widely. So, okay. Have a look as we come through. Great. All right. Thanks, guys. Keep the questions coming in. It's really good. We're going to try our best to kind of filter them and bring them all back to you. But I think for now, Joe, I think we're going to come to you next, weren't we?
Oh,
Right?
yeah. So, I mean, like David was much more sensible than me and put everything on one slide. So I think, Paddy, if you just call up my slide that says key points, and then I would just talk around that.
Certainly will, Joe.
Oh my gosh, you've just made my face really big for myself. There we go. That's much better. So it's interesting what Paddy was just saying there about like money being the driving force. So it'll be slide 6, please, Paddy.
Sorry, Joe, I'm getting the old, let me get slideshow. There we go.
Yeah, perfect. Thank you very
Joe.
much.
This one, yeah.
Yeah, so I mean, like, just touching on what you're saying about the money being a bit of a driving force for senior leaders. So one of the things that I'm going to just talk about is like enhancing staff well-being. And we know that staff turnover, if we address staff well-being, can be really reduced. And when you think like the average turnover in health and social care is estimated to be from 20% through to 33%, and the cost for recruiting a single support worker through interview, use of agency to cover that sort of notice period, from the person leaving to the new person, training the person up, is estimated to be between £2,000 and £6,000. Each staff member that leaves can cost a huge amount to an organisation. So, yeah, having good staff retention saves the company money, but also we know that it really helps embed PBS, because if you don't have a consistent staff team, we're going to have to keep training new members of staff, communicating the importance of implementing PBS and all of that sort of stuff. So one of my key points is PBS is only as strong as the people delivering it. If people's well-being within the staff team is not taken account of, we are much more likely to see staff burnout, them taking behaviour personally. And if they're taking it personally, they're much more likely to be reactive and go off with stress, even if they don't leave the organisation. And therefore, investing in staff well-being should be something that we should be doing. It's not a nice to have. It should be embedded throughout the organisation. And someone mentioned that we use the PERMA model throughout our organisation in the chat. So one of the organisations that we've been working with, we've looked at embedding the PERMA model into their staff supervision forms. So through each supervision, they're taken through that, like positive emotion, what have you felt engaged with, etc. And then also that sort of general questions of, do you feel like you have a good work-life balance? What have you really enjoyed about your role over the last month? What have you found really difficult? And then those reflective sort of practices around, how have you enjoyed working with this person? What's gone well? What's not gone well? And what we've actually found in that organisation is that of the staff team of 40, literally no one handed in their resignation during the whole of 2024. So even on really conservative estimates, when you think of that 25 to 33% of people leaving an organisation turnover-wise, and £6,000 recruiting, that on its own is probably saves for an organisation very conservatively £16,000, which is really quite significant. The last point there is that wellbeing and PBS success are so interconnected. If we don't have a consistent staff team, if you've got that high staff turnover, your implementation of PBS across the system is just not going to be particularly successful. And that's because we need that sort of like data-driven approach. So each time we have a new staff member, they might need training up in the importance of filling in incident forms, and there's notes and how to do it consistently. We also need people to be supporting people that are in services consistently. So it's just all of those kind of things that if we address wellbeing, we'll have a much more stable staff team. Okay, there we go, Paddy. Hopefully I've wrapped that up quickly enough so we can get back on time.
Champion. Thanks, Jo. Well done.
Yeah, the slides shouldn't be changing. They would have done, but basically I asked Paddy just to put this up so that we kept it short and brief.
Yeah, because we're not very good at that, or I'm not. Yeah, lovely. Thanks, Jo. Few people asking about the PERMA model, Jo, as well, and I just wanted to say, I think, yeah, this is a panel of folks that pretty much love the PERMA model. But it is great using it in supervisions, as you referenced, Jo. If anyone is interested in that, there is a workplace PERMA profiler that you can download from Seligman's kind of website, which is great. It's a suite of questions that explore the well-being of your staff. So if you want to find that, it's really great. Okay.
Natalie saying, are your findings published? Not yet, but we're in the process with Sandy having supervision to write it up. So fingers crossed, it should be very soon.
Fabulous. Thanks, Jo. Excellent. Okay. So can you link the workplace profiler in the chat? I'll have a go. Yeah, I'm trying to host and do this. I'll see if I can. I'll see if I can figure it out. But if not, we'll post it afterwards or whatever. But yeah, I will have a go at that. Anyway, moving on. Charlotte, over to yourself. Let me just take.
Thank you,
Jo.
So I'm going to just talk through some of the key strategies that I've found have been really helpful in trying to gain that kind of buy-in, both at an organisational level, but also at the different levels within an organisation. Because I find that when I was quite early on in my career and I first started looking at systems-based PBS, it's really helpful, obviously, to get the buy-in from the kind of senior leadership team, from the CEO, and if the organisation then is demonstrating PBS through their values and ethos and things like that, that's great. But then there's also these other structures within an organisation. So you've got the sort of area managers, you've got the more local operational teams, and then obviously the direct support staff as well. So obviously it's important to get buy-in for PBS to be successful. If people don't really understand or share the values, it's going to be an ongoing barrier to then try and implement PBS. And this is something that I've found. So the first sort of strategy that I want to talk through is, for me, it's about building those relationships. I think trying to be approachable, and I think those initial stages of relationship building, you need to be really approachable. You need to be non-judgmental, and I think acknowledging what people are already doing as a contribution towards PBS is really helpful to try and get buy-in, and that also links with that non-judgmental approach. And I think, as David and I think Paddy, you were also saying about this kind of concept of PBS ready, and I think that comes into it a lot. Quite often when you're trying to embed PBS, the organisation will be PBS ready to a certain point of view, and I think it's really important to celebrate the successes and the things that the organisation are already doing, rather than to focus on all the things that maybe they might not be doing. So essentially, building those relationships, what you want to see is this kind of domino effect that's cascaded through all of our systems and processes. So that's only going to happen if the people that are able to influence others are also influenced and on board with what you're trying to achieve. So we need to make sure that we're influencing the right people. So those directors, managers, direct support staff. And part of the effectiveness and sustainability of this kind of systemic PBS is to make sure that people are aware of their responsibilities within PBS. So for me, making it relevant for people's roles and bringing the kind of practical tasks of PBS to life can really help to get that buy-in as PBS becomes more tangible for people, as they can see their part in the delivery of it. So an example of that might be, and I think, David, you did touch on this as well, and I think Caroline, you did as well, but an example of this might be sort of discussing the importance of values-led questions, for example, with recruitment as part of our interview process for support staff, or highlighting to sort of the direct practice leaders how allocation of staff on a rota or a shift plan might maximise outcomes for the people we support. So that for me is that bringing PBS to life, making it relevant for people through that, building those relationships and making it a tangible thing that they can see and that they can work with is really effective in trying to get buy-in. So in addition to that kind of relationship building, I agree that the kind of the engagement with stakeholders is really important. So having this do with approach rather than do to. Engage early on in the process, so establish what people have already done that's contributing to it. Keep communications really frequent and concise to ensure that all of your messaging around PBS is clear as well, especially in the kind of terminology. So as you know, we've just spoken about obviously the PERMA model, but there are sort of varying levels of different interpretations and models of PBS out there. So I think making sure that your communication is really clear as well on what your messaging is around it for the organisation, so that everyone can then be on board with that and track that, rather than it being confusing and people being confused about how that might relate to them. We need to consider the kind of organisational readiness and goodness of fit with that as well. And I think one of the key things that we also need to do is make room for PBS. And the reason I say that is because when we're trying to get buy-in from an operational manager, for example, who are already incredibly busy with a lot of other competing responsibilities, we need to try and make sure that PBS is not then seen as another thing that somebody's got to do or extra work that somebody's got to do. So if we try and make room for PBS at kind of a more senior level, and we reflect that in job descriptions, we reflect that through our policies, people are more likely to see that positively and not negatively, because it's part of what we do as an organisation, and everybody is then accountable for PBS, and that message is really clear from the off, rather than people seeing that as an additional thing that they might have to do as part of their role. So then moving on, I think as you all know, a key part of PBS is using that kind of evidence-based approach, using data analysis, and I think we can really use that to demonstrate the effectiveness of PBS, and again, that's at different levels. So at senior leadership level, for example, that might be sharing case studies of organisations that have embedded PBS really well or really effectively, or we might be able to demonstrate how improved outcomes as a result of PBS leads to improved compliance, which then increases the organisation's reputation, which ultimately leads to more business coming through. Whereas for direct support staff, you're much more likely to get buy-in by sharing those more personalised particular strategies, for example, as part of a PBS plan. So again, making something relevant for the people that you're talking to, really knowing your audience and how to get that buy-in is really, can be really effective to get people on board. One of the key things as well that I've used as this kind of evidence base, and I think it also comes into what David was saying around PBS readiness. I think it can be really helpful to either use an audit or an assessment to provide a good reflection on where the organisation currently is at in terms of PBS implementation. So if you look at that, there are different audits available, but if you are able to showcase kind of where the organisation is, and support the key influences of that organisation to then problem solve around developing that organisational strategy in terms of PBS, that will also really help to get their buy-in at that level, and they can then be taken along that journey, which helps with the engagement as well. And the last thing that I want to sort of talk about, which I think is probably the the more obvious go-to is obviously training. So training all of your staff in PBS, obviously increasing knowledge of PBS through training and coaching. Generally, if people have got increased knowledge and skills of PBS, they're more likely to then embed that in practice, which obviously you're then more likely to get outcomes. And training also really helps to foster that kind of positive culture within an organisation that you really want as a starting point, to ensure that there is this kind of consistent approach in how support is delivered. But going back to that kind of communication and messaging, it's really important that whatever training you are providing, it's really aligned with the organisational values. It's reflected in the policy and within all the systems and processes that you're then putting into place. So yeah, I'm going to leave it there and pass back to Paddy. Thank you.
Thank you, Charlotte. Super. There's been a few questions coming in. I think what we'll try and do is we'll try and answer the ones that are coming in live. I think that's probably the best way to do it. So thanks for that, Charlotte. Okay, so I think just related to your one, Charlotte, I'll try and keep it kind of linked as closely as possible. There was a question. Yeah, you can never find them. Could you just say a little bit more on value-led questions in recruitment? Could you give us an example of something like that, please, Charlotte?
Yeah, so values-led questions in recruitment, it's more about asking those broader questions around what someone's values base is. So what would they want to be working in health and social care for, just so that you can understand more about them as a person and the reasons as to why they want to move into health and social care, because that's not really something that you can train in somebody. So you can increase someone's knowledge in PBS, you can train somebody in a system and a process, but ultimately if they don't fundamentally have the right values base to be moving into it. So I think some of the examples that I've used previously is kind of, instead of asking questions like, sort of historically, I'm thinking 10 years ago when I first sort of started working within PBS, you'd often see in recruitment questions, if you're working in a particularly challenging service, for example, you'd always see a question on, look, when you come into this role, you're likely to experience quite significant challenging behaviour. How are you going to handle that? How are you going to cope with it? Which almost encourages this kind of applicant that then is going to give you loads of bravado and bring quite a negative values base to it, which is not at all obviously what we would be looking for. What you want to do is then flip that question on its head, and instead say, you know, some of the people that we support have got high levels of vulnerability and complexity, and sometimes their behaviour might be presented in slightly different ways. What support do you find is really important around that, or trying to encourage questions about understanding somebody's behaviour rather than, you know, this is the level of behaviour you're going to be experiencing, so how are you going to cope with that or manage it? So yeah, it's just trying to draw out the values base of the applicants when you're interviewing them, because you can't train that. You can't train somebody's values necessarily. And then also being considerate about how you're framing and what terminology you're using during interviews, to not encourage the culture of, you know, you're going to have to come in and you're going to have to manage all of this aggressive behaviour. And I think setting the culture off from the very beginning through recruitment can really help with that.
Yeah, lovely. Thanks, Charlotte.
Can I jump in there as well, Paddy?
Go for it.
What's really important around values is that it's top down and bottom up, and it's met at the middle with management and with the appropriate systems and structures. So an organisation will set their mission, their vision, and they will set their values. Now, how do we know that every single member of staff is actually working directly in line with the values of the organisation? And actually, if we were to look at that and do an analysis of that, probably very few. So we set our values, and it's only really when someone goes so far out of our values, their behaviour is so extreme, that perhaps values are being questioned. So Paddy's mentioned the ACT matrix, which is fantastic for setting values orientated behaviors and values orientated actions, which again means you can have a data-driven, evidence-based approach around knowing, is my behavior right now in line with our organizational values, or is it not? It's a yes or it's a no. There's no gray area in between, because it's the values that are understood. The value orientated behaviors and actions are understood, they're clearly defined, and they're measurable.
Yeah, thanks, David. That's great. And there's a few questions, just linking some of that together. There's a question here about kind of bringing PBS into supervisions as well, that's come through the chat, and I think there's a bit of a link there, because I think, you know, my experience of lots of the supervision that's going on out there in health and social care is it's rubbish. I'm just going to say it, all right? It's rubbish. And some of that is not particularly well informed. So I think people need to think about, why are you doing supervisions? What is it that you want to achieve out of it? If you just want to tick a box and say we're compliant, then go at it and just do what everyone's been doing, that cookie cutter model of that. But actually, it is a fantastic opportunity to safeguard the culture that you have within your organization, within your team, and design it to be so. You know, there are some super tools out there in terms of, you know, observation checklists. You know, has anybody gone and observed the staff? And not in a creepy way, like hiding behind trees, but go and get involved, go and spend time with staff. How are staff performing? How are staff interacting with the people that they support? Is that making its way into supervision, or is it just a template sheet that people sit down and go through? Personally, I think it should be based on what is happening out there in your service, and what information have you got to support you as the supervisor to engage in those conversations with your staff team. So again, I think with a lot of this stuff, we need to design it. If we're just taking that cookie cutter model and repeating, it's not been good enough for a long time. Hugh's talk earlier today about don't forget the staff. If anyone gets an opportunity to kind of hear him talk about that stuff, it's absolutely fantastic. And this is that kind of thing that people are talking about. But it looks like Joe might be about to come in with something. Yeah, please, Joe.
Yeah, I was trying to look for my hand thing and I just can't find it. So thanks for noticing that I came off mute. So yeah, I was just thinking, like, as well, it's that sort of like understanding of why staff might not be following certain things that we're asking them to do. So supervisions absolutely are an element of doing that, but it's not the only way. So we ought to be thinking about things like, do they have the right resources? You know, are those available to the person? Sometimes that's, you know, they don't have those basics, and so our expectations are far too high. Are they told what to do, or are we expecting that they just magically know through some sort of psychic power? Because I think that again sometimes happens. Or you know, there's been a bit of chat around the use of jargon, so we give very jargonistic behaviour support plans and just expect staff to be able to interpret them and implement them properly. And then really crucial, when we're thinking about PBS, we think about that 4-term contingency. It is just as applicable to our staff teams. So are we reinforcing staff for following behaviour support plans, for participating in supervisions, or are supervisions being used as an opportunity to tell people off? And unfortunately, as Paddy said, I think supervisions quite often are not fit for purpose, or are picked up at times to say, like, you're late, you know, you're not following the behaviour support plan. This incident has kind of been your fault. And then it's sort of like, of course, we're not going to find that staff are following and doing things. Okay, there we go. Oh,
Thank you, Joe. Thank you. Caroline's found the hand. Well done, Caroline.
Yeah, that took me all that time, Joe, but I found it. I think we could do a whole session on supervision, couldn't we? I think we all agree there's huge systemic problems with how supervision's done. I guess for us, we had found ourselves into a pattern where we had one kind of structured process for supervision for each tier of role in the organisation. So how our frontline staff would be supervised, and our team managers and our area managers and so on and so forth was all the kind of same. You meet up and you talk about kind of tasks and what needs done and rotas and all those sort of things. So I think, again, just back to the thread through our conversations is that co-production piece. So we took some time to think about actually different tiers need different types of supervisions. Our frontline staff need supervisions where their managers have been out doing direct observations and have been out looking at recordings and being able to talk with frontline staff about what's working well and what's not. Our more senior managers needs to know how are you getting on with getting people through training, what staff are you concerned about, what support do you need to embed processes. So I guess we started a piece of work with all the different tiers in the organisation and looking at what you're looking for from supervision, what do you need from your role, how should we structure that for you, how should we teach our different roles to provide supervision differently. And it's something we're piloting at the moment, is helping. Each role has been involved in writing how supervision's getting done and writing the kind of process with us. So I guess it's a massive topic, but there's something that needs to change about this universal way of how supervision is conducted to think more individually at different stages. But
Yeah, lovely.
I'll stop talking.
That's great. Thanks, Caroline. And I think we're starting to run out of time a little bit, but I think just a couple of pennies worth from myself. Very often when we're consulting with organisations, and people will ask me, how many PBS practitioners do you think we need for an organisation of this size? And I think it's the wrong question. I think it's the wrong question. We need to, you need to undertake that organizational audit and have a look at kind of contextual fit too, because actually if you find this stuff is lacking, if teams aren't able to get together and spend time talking about the folks that they support and the outcomes that they're getting and what it's like to work here, if there are no supervisions going on, you haven't got the foundation for that strong service, for that strong operational delivery, and actually it's going to be really tricky to embed kind of positive behaviour support principles across that if you haven't got that stuff. So actually the conversation Joe was just having, the money that's potentially saved if you reduce turnover of staff, what can that facilitate? What can it facilitate? Does that mean you can bring your team together more to have discussions around the folks that you're supporting? Does it enable you to undertake more robust debriefs with people and do some more kind of root cause analysis as well as your staff wellbeing stuff? So again, I think we're really starting to think around the fringes of this. PBS is way more than having a PBS practitioner, doing some training, doing a functional behaviour assessment. We really need to think about how we engage with our operational colleagues to develop services that work for people, not just the folks that we support, but for our staff teams that are working in them as well. So I think there's some really interesting conversations about how do you build your system, what's really important. Because for me, just parroting the work of kind of Michael West, if anyone's looking at Michael West's work in terms of compassionate leadership, time with your team, we just do not get enough of it to be able to sit together and to talk. And in my experience of doing that, sometimes you don't need us therapists and ologists and all of that half of the time. You get people that are compassionate together, that care about the folks they support, and very often they're going to start figuring out what the solutions are. So I think really key in terms of designing your system and having to think about that, not necessarily all about needing more practitioners, more training. Sometimes it's about how do we ensure that we can get together as a team to talk about what we're doing, to appraise what we're doing, to review what we're doing, to ensure that we're psychologically safe as a team. Those are the things that are really key in terms of underpinning stable services. Okay, I'm just going to have a quick look through some of the because there was a question, David, it's kind of linked to yourself, but I know it's an area that Joe's quite interested in as well, from Maria. Hi Maria, lovely to see you, by the way. Was about the use of kind of capable environments checklist. Could you do that with regards to kind of organizational readiness? Great question. So I'll check it back on the team.
Look, so yes, you can use some of that, the capable environments framework. What we see in the capable environments framework is that leadership and management are two very key elements to that. And the capable environments framework is really a person-centered tool for understanding kind of tier 1 level universal supports for an individual. How would I use the capable environments framework within an organization? I would want to look at the organization as an individual or as a unit. So let's look at communication. Let's look at communication within the organization and what support for communication does the organisation need? What's working well? What's not working well? What about, are there issues around kind of interaction style? I think that comes down to what was discussed previously around very kind of person-specific supervisions. But for me, kind of understanding your readiness for being able to undertake PBS comes down to one of two things. It's an audit, or it's a PBS steering group. And there are pluses and minuses to both of those. My preference will always be a PBS steering group.
Thanks, David. That's great. I'm just kind of running through. I'm just going to try and squeeze a few more in. I know we're due to be finishing now. So if anyone wants to disappear, you can disappear. But I'll try and go through and just make sure that we get the rest of these questions if anyone's taking the time to ask. So, Alistair, you were asking about contextual fit. It can take some time to truly understand a specific service family team, get a handle on it. First step is often referred to as understanding the system, can take considerable time to speak to any leader, support workers, family. Do you have any comments or experiences drawn about the importance of this step and how long it might take? Yeah, I do actually. Not as long as you might think, if I'm being honest. And my advice would be go in with no pens, no papers, no nothing. Just go and hang out. If I'm being honest, it's one of my favourite bits to do. So yeah, at a hospital a few years back, I think we presented on it before at the conference, but and I needed the so again, getting that senior management buy-in. So it was a director from the trust from this particular hospital, and said, look, we're not going to be able to do this unless I get to know this team, the people there, etc., etc. So we managed to build it into the program. It was just 2 days and me just going and hanging out, just going to say hello, asking if you can help, you know, people cleaning the toilets, can I help with that? Can I do this? Can I do that? Just go and get involved in everything, go and speak to everybody. I always find it amazing, you know, those soft skills that lots of us kind of have and that we're working on, you know, some really good soft skills with PBS practitioners very often. Go in and be a friendly face, go in and say hello to people, just hang out. I am always flabbergasted by how quickly everyone will give you all of the dirty laundry from that service in one very quick setting. You know who's sleeping with who's parking in whose car parking space, who's all that kind of stuff, who was punching people at the Christmas party, you know, all of that stuff by the end of kind of you know, just a couple of hours of just going to hang out. So in my experience, just going and doing that, going in with no agenda and just going and hanging out with people, it's amazing how quickly I think you start to understand that context. And kind of the varying with that work that we've done with families, just having multiple visits. You know, very often families do not want us there for the whole day, particularly if we're working on intensive programs. So going in, just popping in, having a cup of tea, you know, providing that opportunity, not going in with pen and paper, and actually building that into your kind of program, just building that into your time to go and spend some time, hang out, chat with people. It's amazing. What we found doing the PFA and SBT process in families, family homes, first of all, for some families, it's overwhelming asking what are your goals? What are your goals? What do you want for your young person? It's too much because they've just been surviving. So actually going and spending some time, having a cup of tea, offering to take people out for a coffee, and slowly kind of moving into that, you start to understand what the values of that family might be. And then you can start getting towards goals when you understand those values. So I think it's a great question, Alistair. And I think you can do it much quicker than people realise. Just go and hang out, use your soft skills, be nice, and listen, you know, really, really listen. I don't know if anyone else has got anything, so I'm just sorry, I'm going to run through and trying to have a look. Yeah, management just walking about is undervalued. 100%, couldn't agree more. Quality supervision. Okay. Totally agree. Oh yeah, that second CEU word is out. What was it again? Quirrell. Yeah, quirrell. It's in the chat. Yeah. Tia's such a Harry Potter fan, so quirrell is the second word. Okay. Let's have a look. I'm just having a look. Yeah, in fact, we're starting to. Yeah. All right. Sorry, I'm really small little. Trying to figure out these questions. Yeah, that's great. Okay. Oh, and I think someone had in there about quality of life measures as well. Was that in here? I don't know if the people just want to stick it in there. So the Kincaid is a really good quality of life measure, if people are familiar with that, and quite a standardized one that's used across kind of research. So Kincaid, the WHO, the World Health Organization quality of life measure. Again, if you speak to the likes of someone like Tony Osgood, who used to be at the Tizard, not into them unless you're doing research, design person-specific ones. I think the question was saying, I don't want the person-specific ones in this exact context, but Kincaid and WhoQual would probably be the ones that I would go to first of all for quality of life measures. Natalie spelled it right. Well done. Great. All right. Caroline, Charlotte, Joe, David, thank you so much for giving your time to do this and for preparing your work in advance. Thank you guys so much. Good format. Thanks, Dave. Thank you, people.